Sarah McKay. I'm doing my practice live exam for head to toe assessment. So I'm outside the door pretending that I'm gonna go in there and not gonna do. But before I go in there, I'm gonna wash my hands and then at least for 20 seconds. And I'm gonna knock on the door, introduce myself for patient privacy because I gotta kind of respect the patient privacy. Not. My name is Sarah McKay. I'm gonna be doing a head to toe assessment on you. I'm gonna be checking your ear, your eyes, your lungs, your skin. Do you have any concern today?
No.
Okay. Can you call your name for me?
Rose McCabe.
Rose McKay. What would you prefer to be called?
Rose.
Okay, Miss Rose. Do you know where you are today?
Yeah.
Okay. Do you know what time is it? What date today? Today's date?
Yeah. July 5th, 2020.
Oh, okay. Well, I'm just doing that because I want to assess my client level of conscience, and which is times three. How much she is oriented? That she's oriented times three because she's answered all the questions that I asked. So I have already washed my hand, but I'm still going to put like a little bit of hand sanitizers on my hand and then kind of wrap it. So, and I'm using my guide to kind of like guide me. I have already checked her meta status. So, Miss Rose. Okay, Miss Rose, I'm gonna be checking your eyes. So because it's head to toe assessment, I wanna kinda like check her pupil status to see, and I'm gonna be feeding like her femur artery just to know. I'm gonna be my hand little cold, just let me know if you feed little cold, okay? Okay. But you look at this pen for me. Okay, I do that just to kind of check her eye status to see like how her pupil reacts, and then it's reactive to light. And then let me see. Oh, sorry. Okay. Now I'm going to check your Freeman. The reason I'm gonna check that because I just want to feed the process over here. And I'm gonna check her ear. Miss Rose, I'm gonna look in your ear, okay?
Okay.
And I'm gonna look on the other one. There is no drainage in her ear. Her ears is dry. There is not no discharge coming out of her ear. And can I look in your mouth for me? Can you say ah? Okay. And I'm looking in her nose. The reason that I'm looking in her nose just so I can know if she having like a mucus and stuff over there. Her mouth is kind of like pink. Her mucus memory is pink, immersed, and her gag reflex is kind of functioning. What I had asked her to do, and I saw that everything is normal. And I'm going to now move to her neck to kind of check her jugular vein distension. Miss Rose, I'm going to be checking your neck to see how you swallow and stuff, okay? And I'm going to be putting my hand right here. I'm just feeding her carotid pulse just to see. Can you swallow for me, Miss Rose? Okay. And I'm going to use my finger just to assess her trachea. Her trachea is midline, and her swallowing, no problem with that. Her jugular vein distension is not like it's not distended. That was one reason why I kind of try to check that. And then I'm going to go ahead and let me check here. Okay. Okay. I'm going to listen to her brachial artery, her brachial trachea, just so to see how she breathe in there. Okay. Miss Roy, I'm going to listen to your brachial trachea, okay?
Alright.
The reasons I do that, because I just want to see how she breathe when she swallow in and out. And I'm going to move on to her nails to check her nails. Miss Rose, can I see your nails for me? Her nails is kind of normal. There is not no ingrown toes, nails. Everything normal, and then it's warm. Can you push against my hand for me? I'm doing that to see a reflex. And then turn your hand this way for me. Can you push against it? Okay, I'm just gonna checking her muscular reflex to see how her muscle strength look like. Okay. Okay, now while I was checking on her nails, I was just kind of observing to see if she has some edema, but there is no edema on her nails. And I'm going to move to her chest wall. I gotta listen to her lung sign, and I'm going to try to check for her AP to her transverse. So Miss Bro, I'm going to listen to your lung sign, okay? While I'm listening to her lung sign, I'm going to go to the left anatomically. I'm going to go between the second intercostal. Will you take a deep breath for me? And I'm going to come right here. I place my stethoscope on her center, her second intercostal on the left and on the right. And I'm going to go here. I'm going to go under her breast. Can you take a deep breath for me? I'm listening to her lungs and using the A spot, and I'm going to go lateral on her towards her axillary, and that sounds pretty good. Okay, so while I do that, I'm still going to listen to her breath sound in the back, but I also want to check her AP. Miss Will, will you sit up for me a little bit? Okay. And I'm gonna listen to her breath sound using my stethoscope from the back. I'm going to start right here because there is a lung tissue right here. So that's what I'm going to start from the scapula. Okay. And I'm going to go over here. And I'm going to come below between the scapula right here. And I'm going to come right here. I'm going to put my stethoscope between the scapula and the backbone, the center bone, because it got a lung tissue in there. Okay. And will you take a deep breath? And below the breastbone, I'm going to come right here to listen to her lungs. And also right here. And the reason I'm doing that is because I have to listen at least 10 to 11 spots just to kind of see what's going on with her lungs. Okay. Now I'm going to check for her AP, which is her anterior posterior transverse. Will you? Okay. Okay. Her AP is less than the transverse, which is symmetrical. Because if it was more than, or if it were even, that means it's asymmetrical. That means there is some lungs issue or problem going on. But her AP is less than the transverse. And I'm gonna now I'm trying to keep my clamp covered. So I'm gonna listen to her. I'm gonna do a breast exam because it's head to toe assessment, so I gotta assess her breast. So, Miss Rose, I'm gonna just be like, I'm just gonna kind of uncover her just a little bit to kind of check her breast tissues and stuff. Okay, will you lay back for me again? Okay. I don't want to kind of like manually expose her, but I'm gonna use my finger just kind of assessing to see. Well, I should have let her sitting down, sitting up first and do that. Miss Brooke, can you sit up for me? Okay. So I'm gonna make sure she in the supine position, and I'm gonna like check her breast, and I'm gonna start assessing for lumps, like lumps and stuff. That's look good. Okay. Miss Brooke, can you lay down can you do your hand like that for me? Okay. The reason I do that because I want to check the axillary and the lymphatic drainage system. Miss Brooke, can you do your hand like that for me? And I also going to go ahead and palpate because I'm still trying to see if I will find a lumps in her breast. Okay. Miss Brooke, can you lay down for me, please? And the reason I ask her to lay down because that expose any lumps or whatever it is, the lumps, not lumps, but lumps, sorry. And I'm going to palpate her again. And her breast is normal. Her breast is normal. There is not no lumps. It's not symmetrical, and it's even. It's approximately equal in size and shape. It's not like uneven, because if it were uneven, then there is some abnormality found. Now I'm going to listen to her abdomen. I'm moving to her lower abdomen now. Okay, I'm going to be assessing her abdomen because I want to listen to bowel sound if it's active or non-active. Miss Pearl, I just try to keep you on cover as much as I can, and if you feel cold at any point, let me know, okay? So will you pull your clothes up for me a little bit, Miss Pearl? Okay. And I'm going to listen to her full quads just to listen to bowel sound to see if it's hyperactive or hypoactive. Okay, and I'm gonna go for a squat. She got an active bowel sound, and another thing that I have forgot to done was to kind of precede the percussion or whatever to listen to her lung sound. That's what I have forgot to done. And the purpose of that just to see how her lungs sound. Miss Brooke, can you sit back up for me? And I'm gonna do that in her bite too. If the video was clear or something, you can hear the sound and the lung sounds is clear. After I listen to her lung sound. Can you lay back for me, Miss Rose? Okay. Okay, Miss Rose. Well, she has clothes on, but I'm just trying to keep my resident ready, warm. Miss Rose, I'm going to be checking. I'm moving on to her muscular squint, her lower extremity. Will you lift for your leg for me? The reason I do that, I want to see how her muscle reflexes look. Okay. Will you lift for this arm for me? The legs for me, please. Okay, let me see. Yeah, it can help her extend. Miss Rose, I'm gonna push towards your feet. Will you push against? Okay, this one is just to kind of know how her reflexes work, and this one right here. And then while I'm doing that, I'm checking for the corner of her skin, or warmer to see how warm. no edema. And I'm going to check the tip of pulse. And I'm going to check the pedal pulse right here. Pedal pulse, I'm pressing in both extremity bilateral. Okay. No deformity, Miss Rose. Can you stand up for me? I know I might have missed some stuff, but the reason I asked her to stand, I'm just gonna try to assess sclerosis because when she's still like 18, so I go like that to see if she have any sclerosis in that. Her muscle is gonna line up. Miss Rose, will you sit down for me? Miss Rose, how old are you now?
16.
Okay, so at this point, even though she's 16, I'm still going to teach her how to do a self-breast exam. So when you have to do a showers, I'm just trying to kind of like educate you on how you can do a self-breast exam. You have to, when you take a shower, you have to be under the shower and then go like and feel your lumps and stuff. If you ever observe any lumps in your breast, and then you need to notify your doctor, okay? Because I'm just gonna try to make sure that you can know how to do a self-breast exam. And that's conclude my assessment. And I will go ahead and make sure my client is comfortable. And I will ask her, Miss Rose, do you need something while I'm still in here?
No, thank you.
Okay. And I will make sure I can document all my findings, what I have found. That's come to the end of my assessment.